talking about future state of CAR T therapy and how to get more institutions, more entities to adopt the therapy, I absolutely believe that addressing the reimbursement issue on the inpatient side is important. That right now, even just major institutions are having difficulty being paid for the therapy. I mean, the losses that they could potentially take are significant. Inpatient is the natural and most conservative place to start when you don't have any experience in the CAR T space. And then I think as time goes by and side effects are less intense and better managed, I think that adoption to outpatient will become natural.
Yeah, I definitely agree. I can see, reimbursement is the biggest issue crippling a lot of centers from even starting the CAR T programs, definitely. And then I will say I'm a little biased. I do think advanced practice providers provide a really great way to stretch the reach of CAR T once we're getting that reimbursement to expand to outpatient, especially if you can use telemedicine or different markers.
Right.
Once it becomes more protocolized and we're able to predict it more, I do think hopefully they'll be included in the CMS wording that they will also be reimbursed for visits, because I do think it's a great way to stretch that knowledge base and stretch what we have learned to reach more patients when there's only one or two physicians at a facility that are able to manage.
Yeah, I absolutely agree. Even within Penn, we use our APPs as first line to manage symptoms and whatnot. So I think that they have to have a seat at the table. I think there has to be that aspect considered in part of the management of these patients. So broadly speaking, I think that that's sort of the next evolution. I think right now on the inpatient side it's sort of in a vacuum.
Yeah.
And doesn't lend itself well to broadly talking about the therapy. I think the advantage of outpatient, of course, is that it's a little bit more commonplace and a little easier to manage. But without side effects being addressed, it is going to be a challenge.
So when thinking about how telemedicine could expand the CAR T and immunotherapy even further, you take the idea of the neuro exam and the code strokes and the telemedicine used with that right now and how protocolized it is, someday how we could reach to community health centers or community hospitals, that if someone came in that had that CAR T card or an immunotherapy card, they could have a telemedicine consult with a physician and
better manage the symptoms and side effects.
Yeah.
I agree. I just don't think that the infrastructure is there yet. So one of the presentations I did somewhere was fitting a square peg in a round hole, and that's really what we're talking about here. Is that you're talking about personalized therapy, and folks are going to all have different side effects and need different degrees of management. You can say that about just general medicine, but I've never seen anything so pronounced in my life. So having folks understand what therapy was given, and having that ability to communicate that wherever the patient goes is really the goal that we all should aspire to. We're just not there yet. We're getting there though.
Someday.
Yeah, someday soon. But yeah, I think reimbursement, then just building an infrastructure within the institution's radius to other community centers in a very viral way, I think will facilitate CAR T therapy. We'll get there.
Yeah, definitely getting the fear of CAR T. I think there's a lot of, because we don't know what's to come, it's so new, there is a lot of fear in those community centers of, can we even handle this?
Well, there's more DLBCL products coming. There's multiple myeloma. We think we know, and each company has its own little wrinkle or nuance about how that therapy's coming to market. One of the things that I fear in that space is that the more that you deviate from some standard process within the space, you put more risk on the patient. So that's part of the education process that has to happen, right alongside managing side effects, all that stuff. And then it's the responsibility, in my mind, of the institutions to talk about it with everybody in their community.
Yeah. So. Yeah, I definitely agree.
Yeah.